Anemia in chronic kidney disease, causes and treatment. Anemia in chronic kidney disease causes the body to produce too few red blood cells. People with advanced kidney disease tend to develop this condition, and it can increase the risk of negative outcomes. Anemia is a category of diseases that reduce hemoglobin, hematocrit, or red blood cell count. This reduces the ability of the red blood cells to carry oxygen throughout the body, potentially causing a wide range of symptoms, ranging from fatigue to organ failure and death. People who have anemia in chronic kidney disease typically have normal hemoglobin and hematocrit levels, but their bodies do not produce enough red blood cells. The kidneys produce erythropoietin, a hormone that stimulates red blood cell production. When the kidneys fail, the production of erythropoietin often declines, decreasing red blood cell production. Watch on to learn about anemia in chronic kidney disease, including causes, risk factors, and treatment. How common is anemia in chronic kidney disease? According to a 2021 review published in Advances in Therapy, anemia becomes more common as kidney disease progresses. The prevalence across all stages of the disease is 14%. The figure rises to 17.4% in stage 3, 50.3% in stage 4, and 53.4% in stage 5. Symptoms of anemia in chronic kidney disease. The symptoms of anemia in chronic kidney disease are the same as those of anemia from other causes. They include dizziness, trouble exercising, fatigue, paleness, trouble concentrating, rapid heart rate, shortness of breath, chest pain in severe anemia. What causes anemia in chronic kidney disease? The kidneys play an important role in producing red blood cells. They produce the hormone erythropoietin, which tells the body to produce more red blood cells when there is not enough oxygen. But in chronic kidney disease, erythropoietin levels are lower than they should be, suppressing the production of erythropoietin. This results in normal-sized red blood cells that carry a typical amount of hemoglobin. But because there are fewer red blood cells than there should be, hemoglobin levels drop below normal. This makes it harder to distribute enough oxygen throughout the body. Anemia is a risk factor for organ failure, so it may accelerate the progression of chronic kidney disease and lead to kidney failure. What type of anemia is chronic kidney disease associated with? Like people without chronic kidney disease and those with other medical conditions, people with chronic kidney disease can have many types of anemia. However, the type of anemia that is a direct result of chronic kidney disease is normocytic, normochromic, and hypoproliferative anemia. This means that the size and color of the red blood cells are normal, and they usually carry normal levels of hemoglobin. Who is more likely to have anemia in chronic kidney disease? Chronic kidney disease is a significant risk factor for anemia. According to a 2020 review published in the Ethiopian Journal of Health Science, the following factors can also increase the risk of anemia in chronic kidney disease: a body mass index of 30 or more, female sex, stage 5 chronic kidney disease, hypocalcemia, comorbidities, co-occurring health conditions. Preventing anemia in chronic kidney disease. Dietary changes may help prevent or manage anemia. People with chronic kidney disease should consult a registered dietitian if possible. In some cases, iron supplements may also help prevent anemia. However, since many drugs can affect kidney function, people with chronic kidney disease should avoid taking medications and supplements without first talking with a doctor. Because anemia becomes more common as chronic kidney disease progresses, it is important to manage chronic kidney disease as much as possible. Early diagnosis and treatment are beneficial. Complications of anemia in someone with chronic kidney disease. Anemia is an independent risk factor for a worse outlook and death due to chronic kidney disease. Anemia can speed up the progression of kidney disease and increase the risk of complications such as increased oxygen demand, left ventricular hypertrophy, thickening of one of the pumping chambers of the heart, cardiovascular disease. Treatment. Treatment for anemia in chronic kidney disease has two components: improving kidney function. This may involve drugs to treat kidney disease, lifestyle changes, diabetes management if applicable. Some people will need dialysis to replace kidney function or a kidney transplant. Reducing anemia. Erythropoiesis stimulating agents or ESA are drugs that can increase the production of erythropoietin. These medications can improve symptoms of anemia, especially if a person also takes iron supplements. However, erythropoiesis stimulating agents can have side effects such as high blood pressure, narrowed blood vessels, seizures. A doctor can discuss the risk and benefits before prescribing erythropoiesis stimulating agents. For people undergoing dialysis, a doctor may recommend erythropoiesis stimulating agents along with dialysis treatments. Kidney disease on its own can increase blood pressure, and erythropoiesis stimulating agents may also have this effect. Therefore, a person taking these medications in the long term may need additional treatment, such as blood pressure lowering drugs.